Hello, everyone. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start, we would thank Universe for giving us this great opportunity with short Gayatri mantra chanted by Professor Regina from Brazil. Professor Regina, please.
Om Bhuvat Swaha Tat Savitur Varenyan Bargo Devasya Dimahi Jiyo Yona Prachodaya. Many blessings to the universe. Thank you.
Professor Regina. And welcome to Ka Homeopathy Study Group Pro Bono webinar hosted by Kavita Holistic Approach. Wishing you all happy World Homeopathy Awareness Week. Today, April 11th, 2021, and we have two honorable speakers with very interesting topics. Gabrielle Traub speaks about live right for your remedy type, and followed by Canadian Homeopathic Medical College Dean Dr. Sharam and Vice President Joyce. So please stay tuned until the end of the webinar. Gabrielle Traub is the founder of World Homeopathy Awareness Week. Before we introduce our speakers, we would like to take the privilege to say that Ka Homeopathy Study Group is very unique pro bono study group from the United States of America, which formed to unite world-renowned practitioners throughout the globe. Ka's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars based on principles of classical homeopathy and provide professional continuing educational homeopathic credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe while celebrating stage 4 cancer survivors through our inspirational book talks. These webinars are for educational purpose only. See expert homeopath for treatment. This is Kavita Kukunur, board certified homeopath from Michigan, USA. President and CEO of Kavita Holistic Approach, founder and director of Ka Homeopathy Study Group. I'm outreach coordinator of CHC PR committee, encouraging homeopaths to become CHC certified. As HNA CPD provider, encourages homeopaths for HNA accredited CU webinars. I'm member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. I thank Ka Homeopathy Study Group entire team for their continuous support. This webinar is moderated by Ka family, Dr. Sweta Singh, Chief Administrator, and Professor Regina Rianelli. It is being recorded as we speak, and we are live on Facebook. We will take questions at the end of the webinar. We will post jot form in the Zoom chat at the end of the webinar. Please fill the form to receive certificate of CU. Let us welcome our first honorable speaker, Gabrielle Traub. Gabrielle completed her M.Tech and a nationally board certified classical homeopath CCH. She has very busy homeopathic practice for the last 20 years. She has worked in hospitals and rural clinics in South Africa. She worked in an OBGYN practice for a decade and in an inpatient treatment center for PTSD, addictions, eating disorders, and chronic pain. She has taught homeopathy in England, South Africa, Pakistan, Dubai, Australia, and USA. Her new book, Live Right for Your Remedy Type, helps support patients undergoing homeopathic treatment with the diet, lifestyle recommendations based on their constitutional remedy. It allows you to have a deeper understanding of yourself and gives advice to parents and partners on how best to support you. For more information, visit www.sandiegohomeopathy.com. And it was very nice meeting Gabrielle in 2018 at Phoenix, Arizona at JHC conference. Let us welcome Gabrielle Traub to our webinar.
Hi, Kavita. So nice to see everybody here today. Thank you so much for coming. I'm going to start sharing my screen and then we can begin with the slideshow. Give me one moment. Okay. So before I begin, I just want to mention a little bit about how my background led me to come to some of the conclusions that we came to. So I studied homeopathy in South Africa, and as part of our training, we actually work in hospitals. We work in an outpatient treatment hospital, and we do research. We do a year of double-blind clinical trials, and we spending many years learning research design and statistics. In addition, we also study things in school like massage and herbology. We learn both Western pharmacology, as well as, delving into diet and supplements. We even learned some acupuncture at school. And then when I came to the first of all, when I went to London, I started teaching at a naturopathic school, very much immersed in, how naturopathic medicine works. When I came to the United States, I started teaching both pharmacists homeopathy, as well as teaching at Pacific College of Oriental Medicine, and I took some courses in Chinese medicine. I've been very much interested in Ayurveda. So even though I'm so interested in all these other modalities, my focus has always been on homeopathy. I always believe, jack of all trades and master of none. You really have to focus on what you're interested in. I also worked at an inpatient treatment center where it was for eating disorders, chronic pain, trauma, and PTSD. And where we would have treatment team meetings every single week. So as a homeopath, I treated every single patient coming through the clinic, but I would also meet with their psychiatrists and their nutritionists and their acupuncturists and their psychologists, and we would kind of bounce off ideas and share how we were working to treat these very, very sick patients in the inpatient treatment center. And so I feel like I developed a very much a lens of which, seeing how homeopathy fits in with everything else. And this really gave me a lot of backbone into what I ended up developing later on, this idea of how homeopathy can help with this idea of lifestyle. And so let's before we go on, I just want to acknowledge that it is World Homeopathy Awareness Week, which began yesterday on Hanuman's birthday. And week is celebrated all around the world. Unfortunately, with the pandemic, it's very difficult to celebrate the way we used to, but we are still doing a lot of webinars. And like today, I really wanted to make sure we did something for World Homeopathy Awareness Week to share with homeopathy to the world. And the theme for this year is homeopathy and sustainability, the ultimate green medicine. So let's dive right into my concept of live right for your remedy type. And I find that my patients today want to be involved in their care. They want to know what else can they do besides homeopathy to help themselves. You give them a really good homeopathic prescription, but they want to know more about, which diet is best, what exercise should they be doing, what else can they be doing for themselves. And especially regarding diet, the diet fads are changing constantly. Every single year, we have a new set of the best and greatest diets that are available. But are these really going to be the best for our individual patients? Because homeopathy is individualized medicine. I find that a lot of providers tend to recommend the diets that work best for themselves and not taking into account, sure, it's great that that diet has worked for you, but is it really best for every single individualized patient? The other thing to notice is that our needs are constantly changing. Our lifestyle recommendations change according to the season, for women, especially according to the phases of the menstrual cycle. Did you climb a mountain that day, or did you just lay on the couch? Did you take an exam, or did you just lay on the beach? Have you been recovering from an illness? And, just things like drinking habits, exercise habits, all of these things factor into what our bodies truly need to stay healthy and balanced. Now, I want to make it very, very clear. Our role as a homeopath, and the reason for this lecture is not to turn you all into naturopaths or nutritionists. That is not the role of the homeopath. However, our understanding of our patient's constitutional type gives us invaluable information to guide them into making simple lifestyle choices. Just very simple. This is very pragmatic. It's simple. What else can we do to support our patients to get even better results? And why aren't we already doing this? Well, for myself, I know, and this is why I developed this book, is a lack of time. We spend so much time on the homeopathic interview. We don't have time to answer all their questions about diet and lifestyle. We don't have time to give them like the nitty gritty, the details of what is going to be best for him. There really just is not enough time. There's not enough information that's packaged. So if we look at the homeopathic literature over the last 250 years, we have a wealth of information. What is best for this remedy type? What is not good for this remedy type? But it hasn't been packaged in a way that's easy just to hand it over to the patient. And that's really something to consider. We have 250 years of documented observations based on a patient's homeopathic archetype. We have the information. It's just not packaged in the right way. And then possibly a lack of perceived need. Maybe homeopaths don't view that as their role, or maybe they think that, the remedy is enough. So for those of you who are new to homeopathy, I just want to share a little bit about what the constitutional remedy is. So your homeopathic constitutional remedy is your remedy that fits you as a whole person. It encompasses all of your symptoms, mental, physical, emotional. It helps to restore you back to balance. We use it to primarily treat chronic conditions. And in a true acute illness, you may need a different remedy. You may need an acute remedy. However, have you ever felt that moment where you're about to get sick or you're just feeling run down and you haven't expressed or manifested the true symptoms of acute yet? You can often give your constitutional remedy at that moment, just when you feel like you're off balance, and will help rebalance you and sometimes even prevent you getting sick or having a milder illness. This is before your symptoms have truly emerged. So in homeopathy, the one thing I like about homeopathic medicines is every patient is unique. We are not all the same. We are all different. There's no cookie cutter homeopathic prescriptions. Homeopathic treatment is patient focused, not diagnosis focused. So why would we all need the same lifestyle recommendations? Shouldn't we individualize our recommendations based on our type? Now, in Ayurvedic medicine, we do have individualized prescriptions, whether you be Vata, Pitta, Kapha, or whatever combination of those. But in homeopathy, we really have a deep understanding of every single one of our patients' homeopathic archetypes. And so we can take it even further, take it even more individualized, very, very specifically to what that patient needs based on the driving forces underneath their physiology. Now, many of you may think, well, isn't the remedy enough? We just homeopaths. Can we just give a remedy and be done? However, Hahnemann wrote very profusely in the Organon how incorrect diet, lifestyle, emotional stresses and environment can hinder treatment despite giving well-indicated remedies. And he's listed this. I've listed the aphorisms where he talks about this in 77, 259. Anyway, I won't go into it. You can read for yourselves. But in many, many cases, he stressed that yes, a homeopathic remedy can be very, very effective, but sometimes you just need to adjust the diet, the stress, or the environment. And even Chinese medicine has a saying, diet first, herb second, and only if all else fails, use acupuncture. I could say that most people in the healthcare profession agree that our lifestyle, our diet, our exercise is first and foremost before you start treating anything. In homeopathy, understanding a patient's archetype, we actually can also understand their weak points, because understanding their archetype, understanding their remedy type, gives us insight into all the pieces of the puzzle. Once we've determined that a patient is a sulfur type, there's a strong likelihood that they'll stick their feet out the covers at night, especially on hot summer nights. And when I was practicing in South Africa, I was often asked by my more superstitious patients if I was a sangoma. A sangoma is like a witch doctor, because how could I possibly know all these things about the patient if they hadn't told me? But we know this because there's certain patterns that run through homeopathic archetypes. And, factors that I believe could influence gene expression. I believe, and we see this in our patients. If a patient comes to me before conception, and they have a long line of asthma in their family, we can actually treat that weak point so that it doesn't get perpetuated and go down the family line further. We can treat these gene expressions, we can influence their genetics. I do believe that. So let me give you an example. Patients with varicose veins are more likely to develop hemorrhoids, which are essentially varicose veins of the rectum. And conventional medicine really has very little to offer them except surgery, which is painful and often the hemorrhoids return. But for seeing a patient's predisposition to varicose veins, we can actually strengthen the integrity of their veins by giving them a homeopathic remedy together with vitamin C bioflavonoids and foods rich in collagen hydrolysate, for example. We can prevent constipation, maybe giving a high fiber diet or supplementing with trifala or magnesium citrate. Now, we know, for example, that calcarea florica patients have a tendency towards developing varicose veins because they have that weakness in their connective tissue, including in their arteries. And this can actually put them at more risk of cardiovascular disease like aneurysm. And this is exemplified in Marfan syndrome. I actually have seen a lot of patients recently. I think it's better diagnosed these days with things like Marfan syndrome and connective tissue diseases and hyperflexibility. And we can strengthen that with the use of remedies like calcarea florica. I do want to mention, however, that just because we have this insight into patients, we don't necessarily, it's not necessarily in the best interest to share it because it could be very damaging. So if you have a patient with calc fluor type, it's not a good idea to tell them that they're at risk for heart disease and aneurysms. Remember, the word of the provider, the word of the doctor can be extremely powerful, and you never ever want to put that on a patient, and you could be wrong. So it's instead of like telling the patients everything that you see about them, instead just make sensible lifestyle recommendations because prevention is always better than cure. Timing of a remedy. This is actually really helpful that we can use timing of a remedy as well. We know that, for example, Nux vomica patients feel worse in the morning, and lacusis types feel worse just before menstruation, or they sleep into an aggravation. And so we can use this timing to amplify or help reduce. So if we have a very sensitive homeopathic patient who tends to aggravate easily, we want to avoid these aggravation times when giving a remedy. However, if we have an insensitive patient that doesn't seem to react very strongly to a remedy, we can utilize these aggravation times to amplify the effect of a remedy. And we can use these very, very strategically. I typically like in general to give a remedy at night before bed because we heal while we're sleeping. In rare cases, the remedy will actually keep a patient up, and then obviously change that time of day to giving it a different time of day. But with patients who are either hypersensitive or hyposensitive, using the aggravation time can be very, very strategic in either reducing aggravations or having improved effect. So I'm going to give you some examples of how we use homeopathic remedy archetypes to make lifestyle recommendations. And I'm going to be using remedies that you know very well. Many of you will know very well if you're homeopaths, to make this very easy to illustrate to you. So I'm going to begin with the homeopathic remedy Pulsatilla nigricans, which is a very, very common homeopathic remedy type made from the windflower. And so in Pulsatilla, their Achilles heel, their weakness is in their circulation, their veins, their mucosa, their gallbladder. And so we know for a Pulsatilla type, eating things like ice cream, pork, oysters, melons, eggs, rich foods and pastries, or even too many raw foods is not good for them. They do not feel good. And this is partially because of the weakness in the gallbladder. They do not tolerate rich or fatty foods very well. Miranda Castro jokes that we should never force our pulsatilla child to eat sausages because they just make them feel worse. And so what diet is good for the pulsatilla type? Well, we know that when a patient eats a no-fat diet and then eats, they can actually be more at increased risk for developing gallstones. But so we want to gently and gradually, very, very gradually incorporate healthy fats into their diet to strengthen their body's ability to digest fats very slowly. So we want things like avocado, coconut oil, chia seeds, olive oil, and lightly cooked foods are going to be better for the pulsatilla type than too many raw foods. So this is why we try to create balance. Now, as a patient starts to respond to their remedy, they'll be able to handle and manage foods better. But as we're starting to treat them, just to take the burden of the gastrointestinal system, take the burden of the gallbladder, it is a good idea to recommend to them to avoid some of these high rich foods, heavy fatty foods, until their gallbladder is working better under the influence of the remedy. For a pulsatilla type, they have sluggish circulation and sluggish lymphatics, so exercise is so important for them. But they need regular, almost daily, gentle exercise, preferably in the fresh air. We know pulsatilla types feel much better for the fresh air. That really helps them more than any other remedy type. It's so helpful for them. So why not exercise outside? Pulsatilla types also do best in company. So it's always recommended to exercise with a friend or an accountability partner. This will help keep them engaged versus solo exercise. We know our pulsatilla types don't drink enough water. They just are thirstless. How many of us actually tell our pulsatilla patients to drink more water? Even though we know that that's really, really important, many of us fail to do that. So giving guidelines on hydration, limiting diuretics, like too much coffee and tea. So that's really important to let our pulsatilla patients know that all of these things together with the remedy will improve their long-term health and longevity. So for pulsatilla patients, initially in the beginning of treatment, it may be a good idea to give them supplements that can help them digest or emulsify those fats, because they do need the fats to build their hormones. We know that pulsatilla has a lot of hormonal issues, and their inability to digest fats properly can be one of the reasons why they have those hormonal imbalances. So recommending in the beginning of treatment some ox bile or lipase may be helpful for our pulsatilla patients. For the pulsatilla patients who have issues like PCOS, infertility, menstrual irregulations, and so forth, a supplement called myoinositol can be really helpful for them just to balance that out in the beginning. Also, the pulsatilla patients who have a lot of fluctuations during their hormonal cycle can be benefited by evening primrose oil or starflower oil in the beginning of their treatment until it's taken time for their remedy to kick in. Now, these things are not essential. Sometimes I like to, in the beginning, just give the remedy, not give anything else. And it's always better to stagger things in slowly so you're not giving them too many things. It's so difficult to assess how they're reacting if you introduce too many things in the beginning. So you always want to see, can the remedy kick these issues by themselves? But if not, these are additional things that can be used. Now, Robin Murphy wrote in his books that pulsatilla types don't do well with iron supplements. So in every situation, you have to look at the pros and cons. If somebody is severely anemic, then they may well need iron supplements in the beginning until their remedy has kicked in. Or you can just simply give iron-rich foods, to blood-building foods to support the pulsatilla type. So What I like to really have for my patients is, instead of coming to me in crisis mode, I like to have a plan that they know which types of situations could potentially be challenging for them, and then maybe check in with them, or, redose their remedies during those challenging times. And the types of situations for pulsatile that are challenging can be like periods of hormonal fluctuation, like before or during their periods, during puberty. So if we know we have a young child growing up who needs pulsatilla, we can predict that puberty may be a difficult time for them, and they may need some additional support during this time. During menopause, childbirth, and pregnancy can all be challenging times for the pulsatilla patient, and they may require some additional support, maybe just some more regular follow-ups during that time. Situations. So our pulsatile type are very sensitive to feeling lonely, or they have the feeling of abandonment or feeling forsaken. And there's certain situations that can definitely stir up those feelings for our pulsatile patients. So one of them could be starting a new school. For example, where we live, our schools just started after the long pandemic, and that can be really challenging for a pulsatilla patient who may not have a lot of friends in the class yet. And so once they've established a connection with their teacher, with their friends, they're fine. But beginning a new school, being sent off to boarding school, leaving home to go to college can be especially difficult for a pulsatilla type, and especially separation from a partner, whether that be a breakup, a death, a divorce. Those are the times where they need some additional support, where either, more frequent dosing of their remedy, more regular follow-ups, or adding some adjunctive therapies that we'll discuss later on. What about the environment? So pulsatilla types need fresh air. It's almost like they need that oxygenation of their blood. It's really, really important that they get fresh air, lots of windows open, weather permitting, of course. Some pulsatilla types find that getting their feet wet aggravates them. Sometimes they can cause some menstrual disturbances, or they can get sick. And even, wading in cold water, but also getting a pedicure. Sometimes if pulsatile types, have their feet sitting in a foot bath for too long, can aggravate them. Pulsatile types are also sensitive to the moon phases. All phases on the moon, they can be sensitive to. So that's just something to be aware of, to, have them be aware of that and maybe get additional support if they need it. So what I find is very, very helpful, especially for my parents of, patients, is to be able to identify the red flags. How do we know that they're off balance? How do we know that they're starting to get sick before it becomes a full-blown illness? And a lot of our parents will be able to tell me, I know exactly when my child's getting sick. They will have X, Y, and Z. But there are specific signs of the pulsatilla type that we know that they're starting to get sick. So they'll start to get a nasal discharge. And even before it turns that classic pulsatilla color, like yellow-green discharge, it may just start off with a clear discharge. They may start to get like goopy eyes that crust together. They wake up in the morning and their eyes are goopy. Maybe they'll be more clingy or needy than normal. Some of them get like a bad taste in their mouth or a coated tongue. Sometimes they feel nauseous, or they may have some vaginal discharges that are non-menstrual vaginal discharges. These are all signs and symptoms that our pulsatilla patient is out of balance. And if we can give them a dose of the remedy, or maybe improve some lifestyle things like getting more sleep, clean up their diet, we can actually nip it in the bud and they won't get sick. So it's really nice for parents to know, okay, these are the red flags. These are the things that I can tell. I actually had this just last week. My son woke up one morning with like a bad, water tasted bad for him that day. He drank water and he said, Mom, I don't know why this water tastes really bad for me. That was unusual. That was a red flag that he was about to get sick. And so all of us, if we pay close attention to our children, will notice those little red flags that we know what could be a sign that they may be getting sick. So what about when they are sick? What things can we do to support our pulsatilla patient, as a family member or caregiver. So even when they're sick, it's a good idea to get fresh air. We can even just like crack a window open, or maybe have them, if they're not feeling too bad, open up a window or sit outside in the sun for a little while, provided that there's a gentle breeze and it's not too windy. Pulsatilla types feel better for changing positions constantly. You may be sitting up or laying down or turning over to the side. Unless they have a fever, getting very gentle exercise may be helpful, especially outside, maybe doing some gentle yoga stretches or Tai Chi, or maybe a short, gentle walk. They often feel better for applying pressure or cold packs to the part that hurts. Um, they need to drink enough fluids, especially pure water. And often when a pulsatilla type is sick, they're not thirsty. Often when we give the remedy, the thirst will come back. But sometimes we just need to tell our patients to remind them to drink some fresh water. When caring for a pulsatilla type, they need a lot of sympathy. They need a lot of touch and attention, hugs, caring words, or even just listening to how they feel, like asking, "How are you feeling today?" Now, when we have a pulsatilla child with a sepia mom who's overworked and overwhelmed, she may just get irritated by, this clingy, needy child that needs a lot of sympathy and constant attention. However, this truly does make them feel better. It is just their remedy state. So it's good to, help parents understand their child's type and what's going to make them feel better when they're sick. It really does help them feel better much faster. Now, I want to be very cautious here, because if I have a patient that I'm treating, I don't just want them to take remedies without telling me indiscriminately. But it's really nice at 5 o'clock in the evening or in the middle of the night or on the weekend to have some remedies on hand that could be beneficial. So in the homeopathic literature, we understand remedy relationships. We understand that pulsatilla is a ranunculus, and part of the Ranunculaceae botanical family, and so is aconite. And we know that chronically, pulsatilla types often need aconite in an acute. We also know that pulsatilla grows in sandy soil, and a chronic remedy of pulsatilla is silica. We know that pulsatilla and kali sulf are very similar, and often one will need the other. And so it is nice not to ever take a remedy without asking your homeopath first. You always want to do that because you really can interfere with the treatment. But which remedies can you have on hand, and discuss this with your homeopath before taking any. Sometimes some of these remedies are difficult to find. They may not be available, just over the counter. So it's good to have some of the remedies that are acutely indicated for certain remedy types on hand. So let's talk about pulsatilla in relationships. If you have a pulsatilla partner, it's really important to understand their love language, what makes them feel better, what makes them feel worse. So pulsatilla types have a very deep-seated feeling of feeling forsaken. They're very sensitive to rejection, to abandonment, and they have a strong need to feel loved and safe and taken care of. Their love language is physical affection, like touch and hugs and massage, time together, told that they're loved. And so if a Noxvomica husband keeps buying a pulsatilla type new presents or gifts, and that's not their language of love, that's not going to fill up their bucket. They need to feel loved in a very specific kind of way, and this is the only way they will truly fill their bucket and make them feel loved. They're very sensitive to being shouted at, shut out, or any perceived aggression. They're so soft and gentle. Any aggression is very threatening for them. They also have a strong desire to please, and they also have a tendency to develop in codependent relationships. If they are given the space to talk about what is bothering them, to cry freely, and are offered hugs and reassurance, they can feel better very, very quickly. They just need that hug. They just need that reassurance that they're okay, that you love them, that they're going to be all right. And then they just like instantly brighten up and they're okay. So it's really actually easy to make a pulsatilla type feel better. It's very, very easy. But for people may perceive it as a weakness to need that constant reassurance or needing that hug. If you don't provide it, the pulsatilla patient is not going to feel good about themselves. They may ignore problems in a relationship. They are not, as I mentioned, they can develop codependent relationships. And they're most receptive. If you want to talk to a pulsatile patient and be heard, if you can put your hand on their shoulder or their hand on their back or make some kind of physical contact when you're talking with them, they're going to hear you better and be much more receptive to what you're saying if you talk about the problem. Also, when you have a pulsatile partner, always end the conversation. You can have a difficult conversation, but always end the conversation by reassuring them how much you love them, how much, and so forth, because that reassurance is going to make them feel much better. You want to zip up the conversation with ending it with that reassurance. And also always resolve conflicts before going to bed. What about a pulsatile child? Well, for any child, we know how important that attachment is, that skin-to-skin contact, breastfeeding if possible, the baby wearing that kind of close attachment is going to really help them, their self-esteem. It's going to help them feel more confident. But this is especially true for our pulsatilla babies because it doesn't matter how much love you give them. It's almost as if they're born with this feeling of being forsaken. They seem to be starving for it. And so creating that early bonding and attachment will really help them later in life. It will help them with their relationships later in life and set them up for success. Children may have a hard time sharing your attention with others. So if a new sibling is born, or if you have a new partner, or any kind of situation where they have to, vie for your attention is challenging for them. For any child, but especially for a pulsatilla child, I highly recommend setting up 30 minutes of special time every day. And that special time is one-on-one, just them. It's announced as special time. It's not just, you don't just, have it. You always say, okay, this is going to be your special time. You put a timer on it if you need it to be timed. And in that time, you are completely present to that child. You do not look at your cell phone. You do not look at a screen. You ask them what they want to do during that time and you follow their lead. That special time will not only give them that security and confidence and self-esteem that they need, it will also make them much less clingy and needy and more accepting of sharing your attention with others the rest of the day. You want to instill with them a deep sense of feeling loved that will carry with them into their adulthood, even if somebody else is not giving it to them. If your family has a religious or spiritual affiliation, connecting your pulsatilla child to that can be really, really helpful, just to have a higher source to connect with, to tap into at any time. But pulsatile types can become quite rigid and superstitious in their beliefs, even fearing losing God's love and not constantly praying. So you want to make sure that it's a spiritual connection that is not fear-based, that is just purely love-based and is there to support them, but doesn't have that fear element associated with it, which can actually be even sometimes more damaging to a pulsatile patient. Pulsatile children can be those like wonderful kids that just want to please and help you with everything. And especially if you have other children to take care of, they want to help, they want to be like mommy's little helpers. But you also have to be aware that you want them to be independent. You don't want them to constantly have that desire to please others. You want them to develop that self-love in themselves and not needing it from an outside source. These children are sensitive, and we know when we're parenting different children that every child needs something different. This child needs very gentle and loving discipline. They do not do well with any kind of violence or aggression. It doesn't help them in any way. And again, they are usually good listeners, but when you want them to listen, just put your hand gently on their shoulder, look at them in the eye, and tell them what you need from them. Pulsatilla types I found working in the eating disorder clinic are at risk for eating disorders, for developing eating disorders, especially bulimia. So it's very important to avoid using food as a reward in these children. I know so many parents, when they potty train their children, they use the M&M method, or they, if you just do this, you'll get your dessert, or whatever you want to say. That is not a good idea for these pulsatilla children, especially. It's not really a good idea for any children, but especially for the pulsatilla child. You also want to encourage them to develop their own opinions, their own interests, their own hobbies. And this will prevent them from being influenced by their peers in their teenage years, and also in their relationships, taking on whatever their partner is taking on. So for a pulsatilla patient, the best adjunctive therapies on massage are just the massage can help with their lymphatics, it can help with their circulation, it gives them that physical touch, which they do so well with. And also psychotherapy can be really helpful for them. In psychotherapy, just having somebody validate them, listen to them, acknowledge them is really, really helpful. They have a good cry, and then they get a hug, and they just feel so much better. However, it's important for the psychotherapist to understand that even in a psychotherapy relationship, and even with a relationship with you as a homeopath, they can develop codependency. So the goal of treatment is to develop their own therapist within themselves that they can call on, that they can connect to. It can be beneficial for them to graduate out of individual therapy into group therapy, and having like a support group can be very, very helpful for the pulsatilla patient. And any kind of support mechanisms that can be put in place can be very, very helpful, especially in a patient where there's some relationship issues or any kind of abuse. They need that emotional support system to put in place. Um, so a lot of homeopaths don't like their patients taking flower essences or anything else. I personally feel that flower essences are so benign and so gentle. I have never found that they ever interfere with any homeopathic treatment. You may argue, well, it can be difficult to see if the remedy is working if they're taking flower essences. I don't believe that to be true either. I feel that the flower essences are quite short-lived. But they're just very sweet. They're very gentle. They're lovely, and can be used in conjunction with a homeopathic remedy very easily. So the flower essences that can be helpful to support a pulsatilla type are sensory. This can be helpful for pulsatilla types who are not assertive or find it difficult to say no. Heather can be a good Bach flower remedy when your pulsatile patient is feeling needy. And all patients love this. If you can say to them, okay, this is your remedy that you take as you direct it, but these are some flower essence you can take on your own whenever you feel like it. Patients love that. They respond well to it, and it does not interfere with their homeopathic treatment in the least bit. Eventually, you'll find they'll no longer need it, because when you truly heal with a remedy, they'll no longer need these extra support. But in the beginning of treatment, it's a really nice adjunctive therapy that you can use. Okay. So we're going to move on to a remedy called phosphorus, another common remedy, and we're going to look at it in the same way. What are some of the things that can be lifestyle supportive for a phosphorus type? And then at the very end, I'll take your questions. So in phosphorus, their weakness can lie in any of these following areas. Obviously, it doesn't have to be all the areas, but it's usually like one or two areas: in the lungs, in the nervous system, in the adrenals, the liver, the pancreas, the stomach, the kidneys, and the bones. This is such a common remedy type and can really affect every single system of our body. So phosphorus types tend to get depleted. They burn themselves out, just like this match that contains phosphorus burns out. So it's really important that they do a lot of self-care. And self-care means, taking body of their mind, their body, their soul, doing grounding activities, meditation, getting regular nourishing meals, getting what they need to kind of recharge. Phosphorus students are especially prone to burnout, and these students cannot pull all-nighters. They can't go without food. They need nutrition, they need sleep, especially during periods of prolonged mental exertion. This is really important. Phosphorus types can be depleted by loss of vital bodily fluids, things like too much sexual activity, heavy perspiration from saunas, heavy periods can be very depleting for them, or after donating blood. I generally do not recommend my phosphorus patients donate blood. It's just too depleting for them. But if they do have these periods of depletion, the remedy, of course, is very beneficial for them, and we can even sometimes use phosphoric acid if necessary. And they should also replenish with fluids and electrolytes. Phosphorus types are also quite sensitive to chemical sensitivities in the environment, like herbicides and pesticides. These types, I mean, I think all types should, but these types especially should try to eat organic as much as possible. They should try avoid spraying pesticides and herbicides because they are more sensitive to those chemical sensitivities. And so what about diet for a phosphorus type? Okay, so phosphorus patients should not skip meals. They need to try get blood sugar stability. They need sugar stability, so try to avoid skipping meals. If they eat, they should avoid too much sugar. These types tend to be thin, so they're not really at risk of obesity in general. You always have the exception. But still, it's very important that they get blood sugar stability because they're prone to both hypoglycemia and also to diabetes and pancreatic problems. So it's very important to develop blood sugar stability. So you want to make sure that if they do have simple carbohydrates, pair it with fat or protein. For example, if they have an apple, eat some almond butter with it. So always try to keep the blood sugar very stable. They crave salt, so sometimes can eat a little too much salt. But the salt can be nourishing to the adrenals, so a little bit is good. Obviously too much is not. They love ice cream, so they should avoid eating too much ice cream, especially late at night. They love icy cold foods, which is sometimes not always the healthiest for them. I try not to interfere with that too much because they are also worse for heating of the stomach. So that craving for cold, icy things sometimes is what their body needs, although it's not really good to do it too much long term. They are sensitive to arsenic toxicity, so they should avoid eating too much rice, which unfortunately, because of pollution of the environment, rice grows in a lot of water, and a lot of our rice is contaminated with arsenic. If they do eat rice, the best rice is actually going to be a California basmati rice, has the least amount of arsenic. The brown rice is actually worse than white rice because when you take off the hull, you actually can clear some of those, reduce some of those arsenic content as well. And if they do have rice, always soak the rice, drain the rice, cook it in a large amount of rice because a lot of that water will absorb the arsenic as well. So you want to help by stabilizing the blood sugars, having frequent, regular, nourishing meals. Females should eat a lot of blood-building foods around their period. Phosphorus types crave carbonated drinks. So if you can, replace those sodas. Sodas with phosphoric acid are especially bad for them. Do not let your phosphorus patients drink sodas, especially ones with phosphoric acid, and replace them with things like sparkling water, or if they have to have a soda, help them find a healthier alternative. Okay, let's save all your questions for last if we can. And I'll go over questions then. With exercise, phosphoric types want to do kind of exercises that will help their nervous system, help ground them. So yoga, qigong, tai chi, dance, these are all really good for phosphorus types. Any kind of grounding that they can get, whether it's exercising barefoot on the beach or exercising in nature, is so grounding and restorative for them. They love being with people, so exercising with friends or in a group, but sometimes a phosphoric type also does need some downtime just by themselves. So, doing things like meditation is so beneficial for the phosphorus patient. So any kind of grounding activities, rest, eating, exercise, massage, hugging, gardening, time in nature. Some will actually get a grounding mat if they're working a desk job and are at a desk all day long. Having a grounding mat can be very grounding. They need this grounding because they are so flighty. Their boundaries are wide open and they need to kind of be grounded and connected to help their nervous system stay balanced. So what kind of things can be beneficial in terms of supplements for the phosphorus type? This is very, very individualized. So I don't like to give a blanket supplement recommendation for this type. However, sometimes taking some methylated B vitamins can be helpful for their nervous system. If they are having heavy periods or a lot of bleeding disorders or nosebleeds or lots of iron loss, sometimes iron supplements can be helpful. However, I say this with caution because iron can be one of the most toxic supplements you can ever take. It is one of the most commonly overdosed supplement there is and can be quite dangerous. And so you should always check the patient's iron levels and ferritin every time before you recommend an iron supplement. That's so important. If they do take an iron supplement, they can take it around their periods of bleeding. So for example, I may recommend a food-based iron supplement around menstruation, and then you stop. But it's always a good idea to check iron levels first. Phosphorus types, as I mentioned before, are quite sensitive to chemicals, and so they should be careful with synthetic vitamins. Chinese herbs and Tibetan herbs are amazing. I have such respect and admiration for how powerful they are. However, long-term use, like prolonged use of Tibetan and Chinese herbs, could make the phosphorus type more susceptible to heavy metal toxicity. So they should be, cautious with long-term use of those herbs. And again, those herbs are from nature. Unfortunately, we've polluted our environment to the point that, our earth has so many heavy metals. Our herbs are so toxic just because of what we've done to the planet. So that's another reason why homeopathy is so wonderful, is there's no toxicity with the homeopathic medicines. What can be challenging times for this phosphorus type? So phosphorus types tend to grow tall fast. They grow very quickly. So, during growth spurts, they may need some additional support where they be, just more frequent repetition of the remedy during that time, or maybe just extra sleep or nutrition during that time. Loss of vital fluids, during and after the menstrual period, donating blood loss, vomiting or diarrhea when they losing a lot of blood, that can be challenging time for them. Phosphorus types tend to be sensitive to anesthesia, so after a surgery. And actually, it's a wonderful remedy that can help neutralize complications from anesthesia after surgery. And they are very sensitive to grief. So during a grief, they may just need some additional checking in with a homeopath or some additional support. What are those red flags? What are kind of some of the warning signs of imbalance that can let us know that our phosphorus type needs some additional support? So they very increased sensitivity to light, noise, odors, static electricity, or thunderstorms. So if they become much more noise sensitive or more light sensitive, or I have a phosphorus patient that when they're out of balance, they just shock everything around them with static electricity, that's a sign that they're out of balance. More easily startled, more sensitive to the suffering of others than normal, more fearful of the dark. We see this in children, phosphoric children, that when they're out of balance, they become more fearful, constantly needing company, nosebleeds, being consumed with anxiety about loved ones, being more restless, being even more scattered or distractible than normal. So when they're sick, they need rest and sleep, preferably in a dark, quiet place away from stimulation. Notice whether laying on your right side feels more comfortable. We know that phosphorus types, when they are usually better for laying on the right side. I don't like to impose that idea or thought on a patient. They need to discover it for themselves, but notice whether that feels more comfortable for them when they're sick. Eating nourishing meals. Notice which temperature food and drinks feels best for their body. Phosphorus type may, when they're sick, especially when they're vomiting, they may when food warms up in their stomach, they vomit it out. So is telling them to eat warm foods good for them? Maybe not when they're sick. They need to listen to their body and see. They naturally crave ice cold foods and drinks. We don't want to interfere with that process and tell them to go against what makes them feel better or worse, but just noticing that. They feel better washing their face with cold water, cracking the window open. Unless they chill, they actually may like that cool open air, and avoiding heating or heating vents. Rubbing or massaging aching muscles or having someone massage them can be very helpful. When you care for a phosphorus type when they're sick, give them lots of sympathy and reassure them that they're going to get better quickly. Phosphorus types will, if you tell them they're going to get better quickly, they will respond to that. Also notice that they can appear well even when they're sick. They just look rosy-cheeked and flushed. Again, never take a remedy without consulting your homeopath first, but these are some good, useful remedies to keep on hand. Phosphoric types sometimes need arsenicum album. They sometimes need calc phos or tuberculinum. We know that the chronic remedies of phosphorus are natmur and sepia. We know the depleted phase of phosphorus is phosphoric acid. The biochemic phosphates, those cell salts, can be very supportive in their helping their nervous system. We know that when a phosphorus type gets too much nervous stimulation or during exam time, they can benefit from remedies like caliphos. We know that if a phosphorus type has too much bleeding or like heavy bleeding and they become anemic, sometimes ferrum phos can help them. So again, never, ever, ever take any of these remedies without consulting with your homeopath, but discuss with your homeopath whether you should keep any of these remedies on hand for those emergency situations. What about phosphorus types in relationships? They have a remarkable capacity to love and see the beauty in everyone. Falling in love comes naturally to them. They may date a lot until they find a partner to settle down with, or they may decide to just keep an open relationship with many partners. It's important for your phosphorus type to keep the relationship fresh and exciting, to avoid getting stuck in a routine. Just learning a new hobby together, or language together, or traveling together, or going to a new restaurant, or trying different recipes. They hate the routine. They become very frustrated when life becomes too mundane. They need things to keep the excitement alive. They need new experiences. With the pandemic, it's been so hard for these phosphorus types because they are bored out of their minds. They are very empathetic and cannot bear to see others suffer, but overly concerned about others can make them actually sick. And this is a personal development tip that I learned from Dr. Zach Bush. He says that, this is his quote that had a profound impact on me. He says that empathy can be a toxic thing. It can poison us quickly. We see someone else having an emotional experience, and then we create our own personal emotions to attach to someone else's journey, and then we poison our bodies with that. And he recommends, and this is so important for the phosphorus type, instead of being empathetic, learn to have reverence. When we have reverence, reverence is a profound feeling of respect and awe over somebody, an experience, seeing somebody going through a struggle, and instead of having sympathy or empathy for them, just having reverence for how amazing they are to be in the situation and how much awe and respect of the process. And this state of reverence will help the person that we're being with, because we don't see them, oh, poor thing, look what they're going through. What a horrible, horrible situation. We're feeding in to the struggle and the suffering. If we can have reverence for the process and the experience and this amazing human being in front of us, that can actually help the phosphorus patient from their burnout. Okay. So what about parenting a phosphorus child? It's so important that they get regular meals and bedtimes. They need regular meals. They can have vivid imaginations and lots of fears. They need reassurance that they're going to be okay. Use their colorful imaginations to create ways to banish their fears. I had a patient, Timmy, who was a phosphorus patient and so scared of the dark. And what we did is I had him draw a picture of the monster that he was scared of. And he was such a great artist. And then I said, okay, how can we make this monster super silly and super funny? And he drew all these things on the monster that made the monster so silly and so funny. And then we put the monster picture up on his wall. And whenever he would wake up in the dark and be scared, he would shine his flashlight on the silly picture and he'd have a little giggle. And with the help of the remedy, he was able to go to sleep. So using their creativity, they have such amazing imaginations. Using their imaginations to be creative in solving problems could be really helpful. They have a tendency to be distracted. So you want to organize and simplify their homework environment to be free from any distractions. They can do well with a tutor because a tutor is giving them the attention and a tutor can help them to stay on task. Or if they are with a focused study partner, somebody who's conscientious will keep them on track, or with a group of other conscientious students. If they are in a study group, they can get distracted and want to chat and talk. But if they're with other more conscientious students, that can help keep them on track. And sometimes they study better in group than by themselves. Sometimes you have to test it out. They love to help others and they're very smart in general. So sometimes by teaching another child who's struggling even more than them can actually help them to stay focused, using their PowerPoints, using their strengths, and encourage them to use their creativity to help them study. I had a phosphorus patient who made all these really cool flashcards with these like cartoons. She was studying homeopathy and she was so creative, and this really helped to focus her attention and study better. They tend to be sensitive to fluorescent lighting, so bear that in mind in their work environment. They are also much better after a short nap, a snack, or just washing their face with cold water. This can help support the phosphorus patient. They do well with meditation, yoga, massage, psychotherapy, clinical hypnosis. These are some of the easiest patients to hypnotize. The patients that are referred, the phosphorus patients to hypnotherapists love them. They're like, oh my goodness, these patients are easily magnetized and easily hypnotized. So magnet therapy and hypnosis can be very powerful for them. The Bach flower remedies that can be helpful are red chestnut when they're feeling anxious for others, walnut when they're being swayed or influenced by others, mimulus for fear of the dark, heather for fear of being alone, and white yarrow can help strengthen their boundaries, especially when they're feeling depleted and sensitive to the environment. So always speak to your homeopath before using any aromatherapy oils. Some homeopaths feel that it is not a good idea to mix and can interfere with your remedy. But if they do allow, there are certain aromatherapy oils that are especially beneficial. Cedarwood or any of the woods, sandalwood, cedarwood are very grounding. Basil, bergamot, cardamom, cedarwood, lemongrass, and rosemary help focus. Basil, bergamot, and cardamom also help with burnout. Being mindful, though, that some aromatherapy oils are contraindicated during pregnancy. So we're already at running out of time. So we want to go over a few things, and then I'll open up the floor to questions. So I get the question, which diets are best? Should I do keto? Should I do paleo? Should I do intermittent fasting? So let me just give you like a general synopsis. And again, this is in much more detail in my book. I'm really just giving you a summarized version. So ketogenic diet is good for lycopodium types to stabilize their blood sugar once they've improved their digestion. However, it is not good for pulsatile types. Sulfur types, it can be okay for, but you need to limit the saturated fats for those who have sulfur types who have liver disease. Nux vomica, it's not good for them. And tarantula types should definitely avoid fried foods and saturated fats. And here, you can ask, well, where am I getting this information from? I'm looking at the literature. I've spent almost 20 years putting it together, compiling it, because I am so mindful that I want it to be accurate and applicable and practical as well as useful. Intermittent fasting or time-restricted eating. Now, NATMER types can benefit from it. However, it is contraindicated if there's any history of eating disorder, which NATREM types are more susceptible to. For thyreoid types, it can actually benefit because thyreoid types can also be more susceptible to things like cancer and cognitive decline. But they don't need to fast for that long. Even just a 13-hour fast can reduce breast cancer by 36%. So advise your thyroid patients to maintain a healthy weight, especially their waist circumference. But be careful when you do this because weight is linked to guilt and shame, which can sabotage diets. I usually prefer to wait until homeopathic remedy has taken effect before recommending any diets. And again, I would not necessarily say to a patient, you should do this, but if they ask, these are the things that you can recommend. For anacardium types, they feel best when they eat small, frequent meals. But once their blood sugar has been stabilized and they have better metabolic flexibility, this can be an effective strategy to prevent cognitive decline and other neurodegenerative diseases like Alzheimer's and dementia. For carcinosum types who also may be more prone to develop cancers, a 13-hour nightly fast, in other words, if you eat dinner and dinner by 7 o'clock and not eating until 8 o'clock the next morning can actually dramatically reduce your risk of cancer. So for carcinosum types, I do think that intermittent fasting or some level of time-restricted eating can be beneficial. It is not recommended for sepia types, especially those who are depleted or during periods of stress. New moms especially need regular nourishing meals. I know so many moms after pregnancy want to lose that weight, but they need to do it carefully. And with homeopathic treatment, sufficient exercise and rest, a sepia type can over time replenish her stores, after which time it's fine to do, a 12 to 13-hour fast. Menstruating women should avoid fasting right before ovulation and right before her progesterone is supposed to go up, and her body needs more complex carbohydrates during the second phase of her cycle. Calcareic carbonica types can do intermittent fasting, but have to be a little bit more careful if there's an underlying thyroid condition. Intermittent fasting is not ideal for phosphorus types who have a high metabolism, who need to eat more regular meals. However, if they are not depleted and have established some metabolic flexibility, it may be okay. Iodine types need to eat regularly. I do not recommend any kind of fasting for iodine types. NATMER types should avoid eating too much salt, except if they have low blood pressure or weak adrenals, in which case salt can actually be very nourishing for them. But it's important to look at packaged foods and processed foods and read labels because they can have high amounts of salt. Even if they're not adding any salt to their diet, if they're eating packaged foods, they can be getting a lot of salt. They need to drink enough water, especially if they tend to retain water. They need to eat blood-building foods around menstruation, and they should avoid mint while having homeopathic treatment for the most part. Some get away with it, but for the most part, they should. So what kind of exercise is best for each type? Sepia types, exercise benefits them more than any other type. It is essential. They need exercise. That is part of the prescription. You have to recommend your sepia types exercise. They need it like people need food and water. They do best with rigorous exercise. Dancing is especially good for them. It just helps them mentally, emotionally. It gives them that serotonin boost. Pulsatile types, gentle exercise outside in fresh air. Noxvomica types, they are competitive, and their competitive edge allows them to do very well in sports. However, they should have a balance between both competitive and non-competitive activities so that it's balanced, like hiking and yoga. They also need to stretch. With a strychnine component of the Noxvomica nut, the muscles very tight. They tend to be very tight. They need to stretch. With phosphorus types, be cautious with hot or Bikram yoga because of excess perspiration can deplete them. But if they are able to do it without being depleted, then they make sure that they're getting enough fluid and electrolytes. Ignatia is sensitive to pollution, so should avoid going running during traffic hour near a freeway, in highly polluted areas. Stafford Saver types, they need regular exercises. It's so important in managing their anger and their emotions, like things like running, lifting weights, yoga, kickboxing. Even hitting a punching bag can help let off some steam. Like a podium, they tend to be very intellectual and often neglect their bodies unless they're feeling self-conscious, and then they exercise to look good. But exercise can help them with their digestion and their self-confidence. And they actually do well with high intensity interval training and strength training, and exercises which strengthen their core abdominal muscles, especially like Pilates and yoga. Silica has to be careful about the jarring to their spine. So they need to avoid high impact exercises that cause jarring. However, weight-bearing exercise helps their bone density, which they're at risk of. And they should dress warmly even when they're exercising. Their socks need to be breathable fibers like cotton or bamboo, and this can help keep their nails and their feet healthy. For natrum types, exercise helps their depression. Some of them feel so much better when they exercise in ocean air, like near the beach. They need to wear a hat, a wide brim hat, to avoid exposure to the heads and exposure to the head. Natrum types who tend to get cellulite can use a rebounder or a trampoline, especially if you use a dry brush to stimulate lymphatic drainage. And again, kickboxing, martial arts, or even a punching bag can be helpful to help them manage their anger. Okay, I need to wrap up, I think. I just want to mention a couple of things before we wrap up. Just birth control. I've been researching this for so long, over 20 years, and I have so much to share, and I want you to take a look at my book so you can get all the information. But I just want to share a few more things. So birth control, an IUD is not good for silica types. Having a foreign body inside of them puts so much strain on their immune system. It can cause yeast infection, scarring, or just autoimmune conditions. The same thing with Botox. They should not inject foreign substances into their body like Botox, as Thuya. And a lot of these types are like Thuya and silica are more worried about their appearance, and so they tend to gravitate towards these types of behaviors. Injectable contraceptives or oral contraceptives that inhibit menstruation, so like ones that you don't have a period on, or in some cases they inject contraceptives, are damaging for lachesis, Lycopodium, Metarhinum, Thuya, Simistifuga, and Calcarea that need to have a period to stay healthy and do not do well with the injectables. So just something to bear in mind. So I wanted to mention my book that is hopefully coming out soon. It's on homeopathicbook.com. You can look at it, Live Right for Your Remedy Type. And then I have another book. This is a collaborative book that I'm writing on infertility. And this is my first book that's going to be launched on May 7th. The ebook version is going to be available for just $1.99 for 2 days. So go to homeopathicbook.com, sign up to be announced, because that ebook will be available for 2 days at that very, very cheap price. And then once this book is launched, I'll have more time to launch my Live Right for Your Remedy type homeopathic book. Thank you so much for listening. As I said, I have, this is an area that I'm so passionate about. I feel like we do such good with homeopathic treatment, giving the remedy, and we have all this amazing transformation. But if there's even more we can do to support our patients, we have the knowledge, we have the information, why not have a way to share it with them? So thank you. Kavita, did you want to ask if there are any questions?
Yes, Gabriel. Thank you so much, Gabriel, for this sharing this wonderful information on Live Right for Your Remedy Type, and many congratulations at your 2 books. And Dr. Sweta, please, would you like to take some questions, please, on Facebook or in the Zoom?
Sure, ma'am. There's one question from Dr. Hira Agarwal. Initially, we can ask a pulsatilla patient, we can ask to stop fatty food and ice cream. But if pulsatilla has cured them, then they must further not be aggravated by fats and ice cream. Then only we can say it has helped them. Is this a correct way? Kindly explain.
Yes. So as we treat them homeopathically, this will improve the health of their digestion. This will improve the health of their gallbladder. So yes, absolutely. In fact, our pulsatile patients should slowly introduce the healthy fats to get their bodies, get their gallbladder working better. So yes, eventually, once their body's in a healthy state, they can then incorporate some of these other foods, however, in moderation. Our pulsatile types will never do well if they overindulge in ice cream, if they overindulge in pastries. None of us should be eating that in excess anyway. So what we can find is that when we treat our constitutional types homeopathically, we're much more resilient. We can go to a birthday party, we can have some ice cream, we can eat cake, and we're not suffering the next day. But at the same time, we don't want to be eating that every single night ice cream before bed. So yes, the homeopathic treatment allows us to have resilience and our bodies to bounce back from these things. However, if a pulsatile type on a regular basis eats unhealthy fats or ice cream or too much pork on a daily basis, that can then also cause them to slide backwards. Good question. Thank you for asking that.
Thank you. And can you repeat the name of your book and where it could be purchased?
Homeopathicbook.com.
And that's all
Simple.
about the questions. And for me, it was a wonderful webinar and I
Thank you.
thoroughly enjoyed it. Thank you so much.
Thank
Over to
you.
you, Kavita ma'am.
Professor Regina, would you like to ask any questions, please?
Thank you very much, Gabrielle. It was a wonderful webinar, and your input was very enlightening to all of us. I have a question to you concerning when the locals asked you if you were a witch doctor, because in their minds, if they thought you were sacred, bringing them sacred knowledge of homeopathy and all that. What is your take?
In South Africa, there's a healthy balance between respect and a little bit of fear towards the sangomas, the witch doctors. They're, in South Africa, traditional South African medicine is very much part of the culture. Even though it's more the older generation that uses it, there's respect and there's reverence, but there's also a little bit of fear. And I remember, so in South Africa, when I was studying anatomy, we at the medical school in South Africa, we would go through the same medical training as doctors, and we actually have for osteology, we take home our bones, and the bones they give us are not like in America where they have the plastic bones. We have real bones, that from real people. And so I remember bringing home my bones, and I was studying late at night, and I didn't put them away. And our cleaner came the next day, and there's the skull and all the human bones out, and she never came back. She was terrified, the poor lady. There's a healthy respect between, respect, but a little bit of fear. And so I think that, just my insight into, that we all have as homeopaths, we know about a patient. We know homeopathy is so deep. I feel like our patients have no idea the level of depth that we really look at. We're not just looking to take away that cough or that eczema. Our level of depth goes so deep. And for us to know all this information about them without them mentioning that to them can be a little bit scary. So I reassured my patients that I'm not a witch doctor, I'm not a sangoma, I'm just a homeopath. We have over 250 years of data that we've collected, that we see certain patterns in certain people. And so I don't know if it was more that they thought I was sacred or more that there was a little bit of fear associated with that.
Mm-hmm. Many blessings. Thank you very much. Back at you, Dr. Kavita.
Professor Regina, and since we are running out of time, and if anyone has more questions, please email us at ksteadygroup@gmail.com and we will answer. And Gabriel, when you are saying the real bones, I still remember my experience in 1995 when I got the real bones, and my mom used to tell, put it in a different room. So that is really so much fun. And my colleague, who is a gynecologist right now, she's a famous gynecologist. So all that is in sync with your today's topic. So once again, thank you so much, Gabriel. And since we have another speaker waiting for us, so if anyone has any questions, we will again bring back Gabrielle Traub webinars. And one more thing, I still remember Mirinda Castro's words: "Never force pulsatilla, eat sausage." That's wonderful. So it was a wonderful session, Gabriel, and thank you so much. We would like to take privilege to honor your precious time in sharing your knowledge at our study group with our caste certificate from our team. Kindly accept it. And
Thank
Dr. Sweta,
you.
please. For today's webinar and sharing all your great information, please. You're muted, Gabriel, I think. Yeah.
Okay, here we go. Thank you so much.
And with your permission, shall we invite our second speaker?
Oh, please do. Yes.